am Dr. Nita Shah from Ayush Eye Clinic and Ayush Lasik Center, which is a unit of Agarwal Healthcare Limited. Let us talk about Contoura vision. Out of all the various treatments available for laser vision correction, Contoura is the latest, US FDA approved, the most sophisticated, with the best visual outcomes after the surgery is performed. For that we need this machine, which is the EX500 wave light, which is from Alcon USA, to carry out the treatment. We will take you through the whole list of armamentarium in our clinic through which the patient is taken so as to carry out various scans and check out various data, because with this technique and with those machines we check around 22,000 points on the cornea scanned. It is taken into a planning station and then it comes directly through LAN into the laser machine, which smoothens out these 22,000 points. Our two thumbprints are not same. No two eyes are same. If you are just taking out a spectacle number, it is the same treatment carried out with any machine in any number of patients. With the Contoura treatment, it is a customized, specific treatment planned and executed for that particular eye. And that is how we can start talking about supervision, where more than 13% of the patients see much better than what they could see prior to the surgery with their spectacles or contact lenses. I'm sure you want to know why I am wearing glasses. I'm Dr. Nita Shah. I'm above 45 years of age. I have a separate number for distance and for near. You can see I have gray hair. I'm sure if I was doing it 40 years back, I would have got rid of my power, because I see my delighted patients and I really envy them. But that is the reason I can't do it for myself now, as I'm too old for that treatment to get rid of my power. But I'm sure you can avail of these facilities and get it done before it becomes too late for you, like it is now for me. 40 years back we didn't have any laser. So let us proceed with the whole sequence of events of checking, planning, deciding and executing a Contoura treatment in Ayush Lasik Center. So as we talked about Contoura and the general eye checkup which we do for Contoura patients, once that is done and we deem that the patient can proceed with the other special tests needed to decide whether we should do Contoura for this patient, the first test we do is the Pentagon Test, where the patient is put on the Pentagon and an examination is done, and what we get is scans like this, which tell us that the corneal thickness where we are going to do the laser is good enough, the curvature is good, and there are no chances or less chances of the patient getting any complication, even if it is 5 or 10 years down the line. Once the patient is seen on the Pentacam and we are sure there is no risk in the surgery at all, it is a perfect candidate for laser, we take the patient up on this machine, which is called the Vario, which takes 22,000 points and gives us scans like this, which is directly transferred onto the laser machine so that we can carry out the treatment on those 22,000 points in one cornea which are scanned and give a very smooth and regular treatment for Contoura. So once the earlier two scans are done, the patient is put on the eye trace. The eye trace is a machine which tells us whatever irregularities have been seen, how much of them are on the cornea, on the surface of the eye, and what is internal. It's very important to know that, because whatever is internal is going to be left behind, and it helps us in whatever calculations we do when we plan a patient for Contoura LASIK treatment. This is the anterior segment OCT, where we take the scans which give us an idea whether the thickness of the cornea is adequate, safe to do the surgery, and along with it we check whether the dryness of the eyes is alright or not, because this helps us in deciding the treatment which needs to be given in the form of eye drops after the surgery for Contoura has been performed in this patient. So once we have collected the data from all the machines and put it into our planning station, we would have all the scans here like this for our selection, and we would deselect the scan which we feel is not regular, not same as the others, so that we don't put in wrong data. And then we proceed with the calculations of all the data that we have received, and it goes directly through a LAN into the surgical theatre, into the laser machine. We don't have to type in or send it in there separately, and according to that the Contoura treatment carries out a smoothening of all the 22,000 points which have been scanned on the cornea, and that is how a Contoura treatment can be carried out. We will now proceed into the theatre and see what we do there. Now we have taken the patient into the operation theatre. All the planning is completed and we will be carrying out the laser with the laser machine inside. The treatment would take us around 5 to 7 minutes per eye, because all the data has already come into the machine, all the planning is over, all the checkups are done. There is no pain, there is no injection, and there is no patch. They would just feel that something is being done in their eye, some sensations, but zero pain. This is how we carry out Contoura treatment in Ayush Eye Clinic when we do the treatment here, and the patient walks out into a new crystal clear world, the way they have never seen the world before, without any spectacle aid. So now, why do we want to do a Contoura treatment and not a standard laser treatment? Most important, it is the only one which has US FDA approval. It is the only one where all the inherent irregularities of the eye are addressed and rectified, along with taking away the number. It's not just that the spectacle power is removed, and that is the reason why more than 15% of the patients see the world much better than what they were seeing with either spectacles or contact lens prior to the surgeries. And also the normal known minor problems that some people have at night with laser are rectified, and they don't happen with Contoura vision at all. The reason being, it is like wearing a ready-made shirt off the counter or a trouser and getting one stitched as per your measurements. The comfort that you have with the stitched, tailored, fitted clothes is going to be far superior than what you have taken off the shelf, which is like a standard laser treatment. What is fitted for you is a Contoura treatment. So I'm sure that the vision that you would get would be far superior to what you have ever seen prior to the surgery, even with your glasses or contact lens. Thank you. This is Dr. Nita Shah from Ayush Eye Clinic and Ayush Lasik Center.
The Wavelight EX500 excimer laser features a completely sealed, nitrogen-flushed beam path that is checked in 3 separate locations for energy and consistency, thus setting the standard for both laser precision and durability. Pupil dilation causes pupil centroid shift, or a shift in the visual axis. The Wavelight EX500 excimer laser is able to compensate centroid shift and make necessary adjustments to align with the predetermined treatment profile. The Wavelight EX500 excimer laser maintains a high pulse frequency with a minimized thermal load, allowing only 1 in 5 pulses to overlap. This allows the treated area of the eye to cool before receiving additional pulses from the laser. This treatment algorithm provides a market-leading treatment rate of approximately 1.4 seconds per diopter. Designed to automatically track movements of the eye with a latency time of just 2 milliseconds, the Wavelight EX500 excimer laser automatically adjusts pulse placement to provide patients with exceptional precision and safety.